All right. Go ahead and kick us off if you want, Phil.
All right. Welcome, everybody. Another wonderful evening. Because we won its basketball game this afternoon, so did Michigan. So I guess we should all be happy for one of the other teams, one or the other of those two teams. The first thing, assuming Andrew's there, is to get into a Michigan update. Andrew?
Actually, Andrew's not here. Andrew's going to join us a little later because he is at his son's 11th birthday party. So I'm going to actually just jump right into federal updates, and then when Andrew joins us,
okay,
he can come in with the Michigan updates. But so just a couple things, even before I get to the Affordable Care Act, which is the hot topic, but I just want to mention a couple things. The first thing is that the colorectal cancer bills have been introduced. So our bills to close the Medicare loophole around the colorectal cancer screenings, those have been introduced. We're not doing anything at this moment with them because we're still focused on the Affordable Care Act. But soon we'll probably be out there asking our sponsors, our co-sponsors that sponsored last time, to co-sponsor again on those bills. But with all the success we had in the past 2 years with the sponsors and stuff, there's already a lot of momentum, I guess, for that bill. So we expect here in the near future some more updates from our ACS Canada national staff on where we think that bill's going this year and what we need to do. But those have been introduced, so that is out there, and we will, again, be working on that this year. The other thing happening right now is the budget. National budget actually is supposed to expire in April. The word on the street is that they're going to just pass a continuing resolution to continue to fund that budget at this time. There's really not much for us to do. We did most of our work back in December when they actually did pass a continuing resolution, but they included our money for our moonshot in that. And so coming on the heels of that big victory, if they continue to fund the budget where it's at, we're still have the money that we got through the 21st Century Cures bill. So so that's looking fine. So just two updates in case you hear about those. That the CRC bill is out, they are out there and introduced, and we'll start working on that in the spring. And then also on the budget. The one thing with the CRC bill is that we are supposed to be getting some template letters to editor. So if you didn't submit a letter around the Affordable Care Act or about the health care debate, and you still want to do a letter, we could do a colorectal cancer letter because March is actually Colon Cancer Awareness Month. So there is a tie in there. So I will include that in the follow-up email, an LTE template, so that you can do that if you'd like. All right, that leads me to the big issue of the day, which is the Affordable Care Act. And so this week, the big news is that you can't really avoid is that the House Republicans released their plan for replacing the Affordable Care Act. And so what does that mean? Well, it means a lot. So I apologize, I'm going to read some stuff, and I don't usually read things on this call, but I want to make sure you guys kind of know everything that we know about what's in the bill and what's not, and what's the most important thing for us to know at this time. So before I go on that, the first thing I would say is that, this is going to be a long process. They introduced the bill this week. You already have a decent amount of conservative Republicans coming out and saying it's Obamacare 2.0, and they're not going to support it. Obviously, you have a lot of Democrats that say it's going to weaken the current law. They're not going to support it. So really, this is a starting point to the debate, and it's just going to go from there. And I think the important thing is what it includes, because I don't think any type of replacement plan that moves forward, they're going to take things out of it, because I think there's a lot of things in it that we've kind of won on already, which is they're universally liked provisions, and those are things that hopefully will stay in it. And some of those things that are good in it, that's what we think will stay in, there are prohibitions against pre-existing condition exclusion. So People with pre-existing conditions, same as now, will be able to get insurance. They can't be excluded. There's caps on out-of-pocket spending, like the current law currently has. There's prohibitions on annual and lifetime limits, and also health status rating. So, this is a big thing for cancer patients. Obviously, an annual or a lifetime limit was one of our biggest pushes back in the day. That's not included in this bill, so we're safe there. There's coverage for adult kids up to age 26 that can stay on their parents. That's obviously very important since a lot of entry-level jobs don't include health insurance. You have a lot of kids graduating at 23, 24 years old, 22 years old, and going into the workplace or having time that they're not a student looking for work, and they can still be covered. And then there's guaranteed renewability. So you're guaranteed to be able to renew your life insurance or your health insurance policy. And those are all good things and very important for cancer patients. Now, some of the things that aren't so good on it. First off is that the analysis that KCS Can did, and what most people are probably picking up on and have already heard in the news, is that the legislation is believed to have a net effect of shifting health insurance costs to actually the low income and older patients. And that's actually drawn a lot of fire this week, because that's what people are saying, in significantly reducing the standards, basically that would be quality insurance. The other big concern to us is it curtails the Medicaid expansion. Already a lot of Republican governors have come out and blasted the bill because of that part, the Medicaid expansion part. Michigan's Governor Snyder obviously is not alone as one of the Republican governor proponents of the bill. Another obviously outspoken proponent is Governor John Kasich from Ohio. Michigan has 640,000 people currently on our Medicaid expansion. Ohio has over 700,000 people on their Medicaid expansion. So that's obviously going to be a big point of contention, I think, moving forward in how they deal with the Medicaid expansion part. So, and if you're not on hold, if you could please put your phone on hold. I'm just getting a little feedback. So, a couple other things that we're concerned about. It eliminates the advanced premium tax credit for purchasing insurance. It replaces it with tax credits that are based on age, that are kind of seen as more of a flat tax, that are not necessarily going to make premiums more affordable. Plus, right now, if you buy insurance on the marketplace, those tax credits are immediately redeemable. So, for example, I will use a real-life example. My parents buy insurance on the marketplace. Right now, when they purchase it and they buy it, it costs them $700 a month. It actually costs $1,800 a month, but because they upfront get the tax subsidies and credits, it costs them $700 a month. Under the new plan, you would have to actually buy the insurance at the price and then get the tax credit at the end of the year, obviously making affordability a problem. So obviously repealing those cost-sharing subsidies that make the insurance more affordable in the individual market is a big concern for us. It also increases the age rating, and so older people potentially are going to pay more premiums. It could be as high as 5 times what younger people pay for their premiums, and that's obviously going to be a problem for affordability. It also repeals the requirement that insurers adhere to certain actuarial value requirements, and that basically, it tells the consumers the relative value of their plan, so what their plan actually will cover. So if you can remember back to bronze level and silver, gold, and platinum, where you have those certain levels, people won't know kind of where their plan lies. Let me see, what else does it do? So one of the big things that you're going to hear a lot about is Medicaid. I already talked about Medicaid expansion, but Medicaid as a whole, part of this plan replaces Medicaid's current funding with a per capita cap. And what we do know is it's going to reduce federal funding for Medicaid that's coming into states. And it basically means that states are going to have to find budgets to cover the funding gaps that are going to exist. That's obviously going to be a problem in many states, Michigan included, where funds are tight already, especially in states like Michigan, where our members of our Michigan legislature are already talking about income tax repeals and things like that, which will create huge budget holes. Well, if on top of that they have to pay more of the actual Medicaid bill, that's going to cause a huge problem. So, so that is really worrisome to us. And then also, in addition to that, the bill will also potentially limit enrollment in services to the low-income health. So, if you could put your phone on mute, please. I hear background noise. So that's a big problem for us. Obviously, with so many people on Medicaid and with on the Healthy Michigan Plan, which is our Medicaid expansion, that's a lot of people that are now getting cancer screenings, early cancer treatment that otherwise wouldn't have. We know that it would, it's resulting in less people coming in at late cancer stages. But overall, it's lowering, I mean, you can't show it, but it's lowering tax bills. I'm going to give you one fact on Medicaid expansion in Michigan, which I think is one of the biggest ones of all, which is they actually took and did a study of uncompensated or unpaid for hospital bills. And basically they took the time before Medicaid expansion and they took 2 years after it. And what they found was that basically unpaid medical bills in the state of Michigan to hospitals was cut in half, from roughly over $600 million in unpaid hospital bills prior to Medicaid expansion to just over $300 million in unpaid medical bills in Michigan. So it has a huge impact. This is one of the reasons why hospitals are supportive of it, doctors are supportive of it. We were supportive of it. Governor Snyder saw the economic value of it. Obviously, that uncompensated care basically means people are getting paid now, and half of those bills that were going unpaid are now being paid, and that's good for everything all around, healthcare, the provider, the consumer, everyone. So I think that's really important. So as we're moving forward in this healthcare debate, the good news is the bill that the House Republicans released includes a lot of the patient protections that we've been talking about. But as our kind of transition in our messaging kind of foretold 2 weeks ago, the focus is now turning on are people even going to be able to afford coverage? And is that coverage that they can afford even going to be adequate? Because basically this bill shows that a lot of insurance is not going to be affordable for people, and even if they can afford it, it's not going to be that adequate, and it's definitely not going to compare to what they get today. And so that's going to be a big debate. That's going to move forward. And on the one side, like I said, conservative Republicans are going to say basically it's Obamacare 2.0, and Democrats are basically going to say it doesn't cover what we currently have in law. So it's going to be a battle at Capitol Hill for certain. So our biggest thing moving forward is we're going to continue with exactly the messaging we sent out 2 weeks ago, which was the replacement needs, this healthcare bill needs to address affordability for all people, and it needs to be adequate insurance so that people are getting the screenings they need and the treatment they need, especially for a disease like cancer. So with that, I'm just going to throw it out there if anybody has any questions. I know that's a lot to take in. There's actually a lot more to the bill, but not to get too deep into the weeds. I just want to make sure that have at least an initial understanding of kind of the pros and cons of the bill. So any questions? All right. So one of the things, just to leave it out there, we're looking for more stories around this. So if you know anybody that has stories of people that are on the marketplace worried about it changing, people that had to deal with lifetime and annual limits before the law and now don't, or basically any stories relating to how this law or how the ACA currently deals with cancer patients. We're looking for all those stories because we're going to be utilizing them in the coming months for media requests, all sorts of things. So we're just looking to create a story bank, and we've collected some, but if you know any others that are looking to are worried about this and want to lend their voice, we need all those folks too. So we're looking to capture those stories. One last time, any questions on where we're at? In my follow-up email to this call tomorrow or possibly Monday, I'm going to provide some talking points to you. They're not for us to be giving. They say they're for an internal use only, but really they're for you guys to see, so you have an understanding of what this covers and what it doesn't and what we're talking about and some background. So I'll include that in the follow-up. Any questions at all about any of the federal update before I move into the next thing? All right. So the next thing I have is the Ambassador Action Center. Well, actually, let me back up. Recent activity. I just want to thank everybody for the recent activity out there. We've had a lot of people. We have had people go to town halls. Have a lot of drop-by. We've had a lot of drop-by meetings. We've done letters to the editor. Mary Ann Essings got published. But thank you to everybody that submitted letters. We had multiple accolades and multiple ambassadors actually submit them all over the state. So we have a lot of activity going on, and we're going to want to continue that activity. If you haven't done a drop-by, we want to make sure you still do a drop-by. We still want to look for coffee hours or upcoming town halls, although I will mention that most of these town halls and these coffee hours have been being overrun by people. So we're actually finding our drop-bys to be the most effective way to communicate with at least the district staff on these bills. So I would strongly encourage the drop-bys if you haven't done one already. But just want to thank you for all that activity as we move forward. And soon here, probably not in the month of March, but in the month of April, we're going to start to focus on some of our state activities. And so getting ready and ramped up for our lobby day, or what we're calling now the day at the Capitol. So, thank you for everything you're doing, and we'll keep that activity moving. And so with the activity, how are we going to record it in the future? So as you all know, I kind of prepped you guys all that our Pillars program would be going away and being replaced with something nationally. They announced this at Leadership Summit and Lobby Day, that with with the website relaunch, they redid the acscan.org website, and with that, they've created this Ambassador Action Center. And so we already have a login and a password for all of you. There will be an email coming to you next week about that. And basically what this is it's very much like the Pillar. As I was telling CJ earlier today when I saw him in our office here, we kind of adopted the Pillar structure because we felt that's what most divisions in ACS CAN were doing, and we felt any national program that was going to be rolled out was going to be very similar to that, and we were right. So the Ambassador Action Center, when you log into it, this program, you'll be able to track your activity. And what's better than what we had before is you'll be able to see all the activity you have put in. And it's broken down into 5 areas, which are a legislative action, a team building action, a media action, connecting partners, and then fundraising. The connecting partners is the only one that's new, and really that's kind of partly something we were doing anyway as part of the team building. So So really it breaks down into the areas that we are already doing. You log in, you log your activity. There's a goal amount of points. I can tell you right now that our Pillars program was more stringent on the goal number than this program is nationally. But you'll basically, for every activity you do, you get an amount of points for that activity. And so just based on like the media one, the goal is 50 points. If you do a letter to the editor, you get 10 points. If you actually get interviewed by the media, you get 30 points. So that's kind of how the whole structure goes. But the good thing, one of the biggest problems we had with the Pillars site that we did was we could pull it all, but I had to run a report and send it to you and break it all out in order for you to see it. This way, you're going to be able to log in, see what activity you put in, and see where you stand. It also has national leaderboards by congressional district of, which congressional districts have done the most work and all that. It's just something we plan on rolling out to our ambassadors. We're going to be able to put in our state lead ambassador. All of our athletes are in, but we're also going to be able to have ambassadors with their own accounts log in, and if they do any activity and record it, it's actually going to go towards the grand total of your congressional district and what they're doing. So, so that's, I think going to be really different and cool. One of the other things that's really cool about this, and the number one question we asked them way back in the day, which they fixed to their credit, is that eventually when you do your can raiser page for Lights of Hope, it will feed right into the Ambassador Action Center. So it will show what you've done fundraising-wise on the Ambassador. You will not have to put in that information on fundraising twice. You will use the can raiser page and put it in there, and it'll just automatically feed right into your page on the Ambassador Action Center. So I think that's really cool because then we won't have to duplicate efforts. So that is coming. I am going to be sending an email out with you with a link to where do you get into it, your login and your password. You're going to be able to change your password if you want. I'll also send you a link to a site that has some very brief 6-7 minute training videos. But quite honestly, I think you're going to see if you log in and look at it, it's pretty user friendly, and you're going to be able to figure out, oh, this is how I log my activity here, there, and everywhere. So so that's the kind of what we're moving to. So we're going to encourage everybody to use that and log their points. Now the other thing to point out is that this is going to record all activity from National Lobby Day to National Lobby Day. So the minute you guys left National Lobby Day in DC last year, we count all those points all the way up until you go back to National Lobby Day this September. So so there's actually, we have now a backlog of 5 months here of activity to kind of record and put it in there. And so I've been keeping a lot of the activity as you guys have emailed me with what you've done. I've kept a lot of those emails so that we can figure out what we've done. So, hopefully over the next month you can log into the site, take a look, poke around, start to input your activity. If there's activity you think you're missing or you just want me to let you know what I have, I'm happy to send you not only what you've emailed to me, but also I can pull up what you put into the old reporting system from September to when it went down in December, to send to you what you actually put in the old system. So, but anyway, around it, I'm here to help you with the thing and make sure we get your activity recorded so we're getting credit for it and you're getting credit for everything you're doing. So that's kind of the Ambassador Action Center. I think we'll talk about it on future calls as we move forward, but once you get the information and poke around in there, you'll be able to see kind of what it's all about. So any questions about that? All right. And I think I mentioned this to you. They actually launched it a month ago, but I was waiting to make sure there weren't any bugs in the system before we kind of rolled it out to you guys, because I just wanted to make sure ACS can't hit it all set. We've done that before in the past. They brought out something new, and we run with it right away and find out that there's some problems with it. And I just wanted to wait it out for a month to make sure that we could avoid any potential headaches. And so it seems like it's working relatively well, and there hasn't been many problems, if any. So we're ready to roll with it now. All right. With that, I'll check as Andrew. Have you joined the call?
Yeah, I have, Matt. Thanks.
Okay. Great. Well, then I am going to hand it over at this time to Andrew to talk about, give a little bit of a Michigan update, and then I'll kind of close with some information about our day at the Capitol. Go ahead, Andrew.
We got it. All right. Thanks, Matt. Yeah. Thanks for everyone being on tonight or listening. We appreciate being on and joining us. Just a couple quick updates in terms of what's been happening on the state level. Really, everything has been tied around budget. And so the governor provided his budget recommendation to the legislature. No cuts in our programs, which is good. But at the same point, the $500,000 for cancer prevention and the $1.6 million for tobacco prevention is really abysmal. And so, we'll be meeting with the chairs of both budgets here within the next week or so to have conversations about what they're envisioning and to see if we can't wiggle some more dollars out for cancer prevention or for tobacco prevention. From that, not really a lot in terms of policy-wise happening. With new members in the House, House members are really trying to get their feet under them. We have new policy chairs. So Hank Valpel, who is out of the Livingston County area, is a veterinarian, and he's the chair of health policy this year. Dr. Ned Canfield, who's out of the Thumb, is chairing our budget in the House. And the chair of insurance this year is Lana Tice, who was the vice chair last year, and she's out of Livingston County as well. So Livingston County could be ground zero for some of our issues this year, including oral parity. Senator Hansen has said that he wants to introduce it again, but he's trying to find a way so that insurers won't bring up price transparency and won't push a lot of the issues that killed it last time. So to his credit, he's really trying a lot to do it, but at the same point, we don't want him to throw the baby out with the bathwater. So we're watching, we're trying to work with him. He's trying to do his business right now. And we hope he'll be talking to us here in the next few weeks in terms of what he feels like he's come to. Other than that, we are working on palliative care this year. We're working with the governor rather than the legislature, knowing that there probably really isn't an appetite for the legislature to put together another task force or commission or whatnot. So we're trying to work with the governor to go ahead and do that. And they have been receptive. So we're continuing to work with them, and our goal is to hopefully have some good news at our day at the Capitol. But at this point, we're still kind of moving forward. So with that, I guess I will stop right there, Matt. If you feel like I've missed anything, let me know. But we're off and running with another year.
Yeah, does anybody have any questions about that before I move on? All right. Great. Thanks, Andrew. I'll just mention one thing we are doing next week on Wednesday is what they call Kick Butts Day, and that's a tobacco day for youth to focus on tobacco, youth prevention for tobacco. And so we're actually going to do a small event at the Capitol with a couple of school groups that are coming down, maybe about 24 students, and we're going to have them meeting with their representatives and their senators to talk about youth prevention, need to increase tobacco taxes, and fund prevention programs. So that'll be good. And then the other thing I do want to mention coming up is that Livingston County, Andrew kind of just mentioned why Livingston County is so important. I sent that in the email I sent out earlier in the week. That Livingston County is going to kind of be ground zero. We may be looking for some athletes to go out there for a couple things coming up. I emailed out everybody about March 13th was their first ELT meeting of their Relay for Life. For those that don't know, that's their leadership team for their event. That's what the ELT is. So they have a kickoff on a meeting on March 13th, another one on April 10th, and they have a kickoff on April 21st. I'm planning on going to the kickoff to speak about this, about oral chemo, and basically all of this is in an attempt to be ahead of the ball this time. Last time around, if you remember, our oral chemo bill passed the House, or passed the Senate only a couple of weeks after our lobby day, and we didn't know which committee it was going to go to in the House, and eventually it ended up in House Insurance, and then at that time we had to look at the House Insurance Committee and figure out what are we doing and all that stuff. Well, this time around we are pretty much 99% sure it's going to House Insurance once it gets out of the Senate, and if it does, that committee is chaired by Representative Tice, as Andrew said, and she's in Livingston County, and its vice chair is Representative Paul, who's the other representative from Livingston County. So with the chair and the vice chair being in Livingston County, obviously that's going to be very important. So we're going to be doing a lot in that area to kind of target them. So we'll look forward to that, just to give you an idea of what is actually happening. And so that leads me then to the next thing, which is our day at the Capitol. And I just wanted to give you just a couple minutes here of what to expect at our day at the Capitol, because it's going to be slightly different this year than years past. Most of you have all registered, so I thank you for that. This year we're doing it at the Radisson instead of at the House Office Building. It's one block east of the House Office Building, so we're still right downtown. But we have a couple things that are going to change. So we're doing all our meetings in the actual legislators' offices, and so that means our morning program is actually going to be a little shorter than in years past, because we won't have the benefit of them coming right down to us downstairs. We'll actually have to go to them. We're going to actually start at 9:15 in the morning is when the program's going to start. Our registration is going to be basically from 8:30, 8:45 till 9:15, and we're hoping to have booths set up at our registration, kind of highlighting some of the different areas of ACS and what they do as far as Relay for Life, making strides, planned giving, road to recovery, those type of things, to give some more exposure of all the different things to do, and basically to engage some of our volunteers on things they might not have known we do. And so we're going to have that, which I think is going to be great. As far as the program goes, we're only going to have about speakers for about 10-15 minutes, talk about each of our issues. And then we're going to spend a good portion of the time, probably a good half hour, with Andrew and the lobbyists over lunch preparing everybody for their actual meetings. Talk about the issues and the legislators and the pushback. We really feel it's always the part we have to kind of do last after we talk about the issues, but we also feel like it's the most important part. And we want to make sure everybody's prepared. And in years past, we've had keynote speakers kind of that we've given these half-hour, 45-minute blocks to. They tend to go over. We have question and answer. It really pushes us behind on our schedule. And then sometimes we've actually had to cut out what we feel like is the most important part of the lobby day, which is actually preparation for your meeting. So trying to minimize that, we have some speakers that are coming in. They know they have about 10-15 minutes to kind of just talk about some specific things. We'll have somebody talk about oral chemo. We're going to have somebody come in and actually talk about other tobacco products in our tax. And so I think that's going to be the best use of our time as we move forward. We're hoping to get a video from ACS CAM President Chris Hansen to play a nice, 5-minute video, kind of welcome to all the volunteers from Chris Hansen. So we're looking forward to potentially having something like that. And then, of course, like always, we're going to do our volunteer awards, and we're going to do some of the hook, line, and sinker and other things. One of the things that you can expect here in the next month, I may be reaching out to some of you. We're going to be needing some people to be media spokespeople that we've identified, a couple of people that I'll be reaching out to you soon. We're going to need people to do some of the different parts of the presentation like we always have. Sandra has already confirmed she's going to do the Volunteer of the Year Award and present that as our previous year's winner. But we're going to have our whole ACS CAN membership and ambassador part. I'll be reaching out to somebody about doing that. And then obviously hook, line, sinker, and things like that. So there's be some parts we're going to be reaching out for you to do. So you can plan on me contacting you. But as a whole, the day is about a 9:15 to about 11 o'clock with our morning program. And then we're going to break for lunch for about 20 minutes so people can get it. And then when people are seated and eating, we're going to have about a half an hour where Andrew and the lobbyists will talk. And then it's going to be off to our meetings in the legislators' offices. And then at the end of the day, we will close at the end of the day in the Capitol Rotunda. We've already confirmed a speaker for that. Sarah Swistak, who is an anchor for Fox 47 News in Lansing, is going to be our speaker. She has been active with ACS. Her brother passed away from esophageal cancer. He was actually a doctor. And so she's got a great story, and she's going to share that with us in the Capitol Rotunda. And we potentially will do a Legislator of the Year Award at that time, too. So that's kind of what the day looks like. I just wanted to give you guys the gist of it because one of the reasons I want you to know kind of what it looks like this year is because we have a bigger room this year, and we want to fill that bigger room. We can accommodate probably all the way up to about 180 people if we want. And so our goal is really to get to 125 to 150 people in the room. And so with that, I kind of emailed before, please help us recruit other volunteers you might know that you think would be interested. Same thing I tell our staff as they're recruiting people to come to our lobby day. And as you guys all know, they don't need to have experience with advocacy or anything like that. If they care about our mission, if they are willing to tell their story and tell their story and use their voice, we want those people there, expose them to advocacy, and show them the power of what they can do. That their voice can be heard and that they can have real impact on how things happen in our state legislature and nationally. So please, by all means, help us recruit those folks to come to our lobby day. Right now, we only have about 40 people registered, so we still got a pretty good ways to go. But I just put it out there. If you could help us out and recruit some folks to come, that would be wonderful. With that, I'm going to open up for any other questions that you might have regarding, I guess, anything that we've talked about today. Anyone? Quiet group today, so either we don't have questions or maybe everybody's power is out and they're just huddled around their cell phone. I don't know, but my power's back on at home, so I'm glad to hear that. So if there aren't any other questions at this time, please feel free to email me or call me if anything comes to mind or if you have any questions on anything we talked about. And look for it. I will be sending out a follow-up email. I might not get it because Andrew and I are out of the office quite a bit tomorrow. But if I don't get it out tomorrow, I'll probably get it out to you on Monday with the recording of this call and all the information that I kind of covered and some of those talking points and other things that I mentioned. So with that, I thank everybody. And Phil, do you have anything to add before we leave?
I don't, other than I did have a question about the Livingston County kickoff on April 21st. You were going to be there. Do you need anybody else there also?
You know what? I probably don't need anybody else there, but I welcome anybody that would like to come, just because I can tell you from all my experience doing this that I can always go and talk to volunteers about things, and it has impact, but there's really nothing like the volunteer-to-volunteer interaction. Volunteers telling people, it just has a whole different impact than it does staff. I don't know. Maybe they see me as paid to be there. I don't know. But, so I welcome any volunteers that want to come to that kickoff on April 21st. I welcome you to come there and help me spread the word of how important it is. We're really going to try and get across the point to them that it's not every day that a community can have an impact on a law that could pass that could immediately save lives, and they could. And we're pretty much convinced that if we did the same type of grassroots that we did in Clinton County last year around Representative Tom Leonard, if we did that in Livingston County, we will win, because a lot of the obstacles we face in Clinton County won't be there necessarily in Livingston County. First off, the chair of that committee and the rep from there is not running for speaker, so we don't have as many ties to the whole political part of it or really the money part. They're not going to listen to money as much as our previous rep did, because they're not running for a big office like that. So I think and then one of the other things I'll point out, because I think it's important, is that, we have to keep in mind here in Michigan that these reps, a lot of them run in safe seats. Like, they may run for several months in a primary, and if they win, then they coast. And if they're in second term, none of these reps, I think, have ever felt that type of grassroots. And I think if they do feel that groundswell of grassroots around something, they're going to respond. And I think their response is to move our legislation. So I think if we can mimic kind of what we did in Clinton County, in Livingston County, we're going to be successful. And so, like I said, I welcome any volunteers that can help me out and make it to that kickoff on the 21st, and also looking pretty far ahead. But if we haven't passed it by then, August 11th and 12th is the actual event in Howell for Livingston County Relay, and we'll probably be out there kind of like we were at the St. John's Relay last year, doing something to try to get people to write letters or do something to help with our oral chemo bill. So, good question, Phil. And yes, we'll welcome help for anybody that can come to those things and help us.
Keep us posted on the time for a meeting there.
What's that, Phil?
Give us the information when you get it about exactly what time and location for that meeting. The kickoff.
I can. I'll include that in the follow-up. And then somebody else had a question, I think.
No, that was me, Beth. I was going to tell you I'd join you on the 21st.
Oh, great. That would be wonderful.
Be happy to be there.
Awesome. I also think that obviously, I think it's important if I show up that they think it's important, but I think if there's a couple of volunteers there and myself, I think it just highlights how important that this issue is going to be and how important their role could be to it. So thank you. Great. So if are there any other questions? All right. Well, I just thank you for everybody's activity that we've done up to now, and I thank you in advance for I know all the great activity we're going to do here moving forward. And if I don't see you before it, I'm going to see you at the day at the Capitol on May 3rd and look forward to it. And I'm now off to the grocery store. So everybody have a great night, and email me or give me a phone call if you have any questions at any time. All right. Thanks, everyone.
Bye-bye.
Bye, Matt.